On this Tuesday night, Manitoba's alarming uptick in COVID-19 cases. What's fueling the spread there and why targeted restrictions won't work? Plus, the Quebec Premier's latest plea.
We must remain very cautious.
And who's being deployed to battle the crisis in long-term care homes? A COVID-19 vaccine trial suspended, why it's on pause and why experts say it might be a good thing. Crude Reality.
For oil, we saw in 2020 8% drop in demand.
The new prediction for when demand for oil could peak and what it will mean for Alberta's future. And there's an award-winning app for that, the teenage brains behind a program helping people with dementia.
Global National with Dawna Friesen.
Good evening and thanks for joining us. We begin with a warning for people not getting the message about the spread of COVID-19. Despite repeated pleas to limit social contacts, Canada's caseload is still rising, and targeted restrictions in place now could expand into more widespread measures if cases keep climbing. Take Manitoba, for example. It now has the second highest rate of active cases in Canada after Quebec. That's per 100,000 people. Most infections are in Winnipeg. And the big problem there is the level of community transmission. People young and old are getting COVID-19 in different parts of the community, and contact tracers are struggling to keep up.
What we're seeing here is increasing community-based transmission, which makes it very difficult to take a very targeted approach.
Here is the picture across the country today. There are 26 new cases in Manitoba. Saskatchewan has 34. And starting this Friday, the maximum number of people allowed to gather in private homes in Saskatchewan will be slashed from 30 to 15. Further west, there are 220 new cases in Alberta, 101 in BC. New Brunswick has 6 new cases today. There are 746 in Ontario and more than 800 in Quebec. There are signs the situation in Quebec may be starting to plateau, although the virus is still spreading into new communities. 3 more regions were put into the province's red zone today. The Premier is pleading with people to limit their social contacts.
We'll have to live with the virus for many months, and there's no magic recipe. We must avoid indoor gatherings of more than 15 minutes.
Mike Le Couteur has more detail on where we're at in this second wave and what officials worry about most.
From the start of the pandemic, the goal was always to crush the curve and prevent hospitals from being overwhelmed. We did it once, but the numbers are climbing again as the second wave ripples across the country. And it's cause for concern in Ontario.
All of a sudden we saw acute care beds increasing by 250% in the hospitals. We're concerned about the ICU capacity.
Data collected from provincial health authorities show a sobering trend in hospitalizations, particularly in Canada's 2 largest provinces. Ontario's numbers are below Quebec's trend line, but both are on an uptick.
This is the time to double down on our efforts to stop the spread.
That call for a collective response came as the government responded to a re-emerging trend. Right now, 66 long-term care facilities in Ontario are dealing with outbreaks, and since January, there's been a total of 500 outbreaks. Instead of sending in the army, Prime Minister Justin Trudeau said the Red Cross will be deployed to a number of homes. That will help with the immediate crisis, but Trudeau admits long-term care needs a long-term fix.
I don't think there should be some regions of the country that offer better or worse protections to elders than others. I think that's why the time has come for a conversation between the federal government and the provinces on harmonizing and establishing norms.
Canada's top doctor agrees, but points out it's a provincial jurisdiction that has both public and private-run homes, adding to the complexity. It's why a multi-layer approach is needed, which includes rapid testing. Millions of rapid tests will be sent to the provinces and territories to be used in high-risk or remote areas.
How they're deployed within specific jurisdictions is actually up to the provinces and territories. I believe that the agreed upon approach was more focused on per capita allocation.
And it's expected those tests will be shipped to provinces and territories within the next week. Mike Le Couteur, Global News, Ottawa.
A second human clinical trial of a potential COVID-19 vaccine has been paused because one of the participants developed an unexplained illness. The Johnson & Johnson vaccine candidate is one of 7 potential vaccines now in phase 3 of human clinical trials. All of them must pass this phase to prove they are safe and effective in humans. Suspending a vaccine trial is not unusual, but never has the world been watching this process as closely or waiting as anxiously. Eric Sorensen explains what we know and don't know.
It is a setback for Johnson & Johnson, one person in its vaccine trial with an unexplained illness. It's not uncommon, especially in such a huge trial with 60,000 participants. The company says it has temporarily paused further dosing in all its trials. It's investigating whether the illness is related to the vaccine. The patient could have received a placebo. And it says such illnesses are an expected part of clinical studies. AstraZeneca also paused its vaccine trials temporarily after 2 participants fell ill last month, one with serious spinal inflammation. Experts say it's a good sign that vaccines are not being pushed out hastily.
The public can know that there is an independent data board that's going to be looking at this, and we know in Canada that Health Canada is not going to authorize a vaccine that is not safe for public use.
The whole world wants a vaccine, but there are concerns about safety being compromised by politics. The U.S. president wanted to announce a vaccine before the U.S. election, though he acknowledges now it may not be approved on his timetable.
I think we should have it before the election, but frankly, the politics gets involved, and that's okay. They want to play their games. It's going to be right after the election.
Still, the scale of the research worldwide is astonishing. Vaccine trials at different stages are happening in laboratories from France to the United States and from Brazil to Germany. In all, around 100 vaccines are being developed. And human tests are underway on volunteers from China to the UK to Australia. More than 40 vaccines are in clinical human trials.
I don't think there's been anything of this scale before.
Another hopeful sign, 180 countries have committed to the World Health Organization's effort to finance vaccines so countries rich and poor will get them.
It sets a good example for believing in and trying to achieve equitable access of vaccines.
Meantime, Canadian officials are confident in the Johnson & Johnson evaluation.
I'm sure people will resume the trial as soon as they are satisfied that patient safety isn't compromised.
COVID-19 research is happening with remarkable speed as the world waits for a vaccine that will both protect from the virus and do no harm. Eric Sorensen, Global News, Toronto.
One of the many questions scientists still have is whether you can get COVID-19 more than once. The U.S. now has a confirmed case of a patient who was reinfected, and his second illness was worse than the first. The case, published in The Lancet, involves a 25-year-old man with no known immune disorders. He tested positive in April and recovered, then went on to have 2 negative tests. And 48 days after that first positive test, he tested positive again. Researchers say what is worrisome is his second illness was worse than the first. The man required oxygen and ended up in the hospital. He has since recovered again. Similar cases have been reported in other countries, and the findings suggest exposure to the virus may not guarantee immunity, but much more research is needed. Ontario is dealing with what's believed to be one of the largest outbreaks at a fitness centre in Canada. At least 61 cases are linked to a spin studio in Hamilton. 44 gym users and staff members at Spinco have tested positive for the virus. 17 cases of household spread have also been identified. And public health officials warn up to 100 people may have been exposed. Infectious disease experts consider it a super spreader event, a lone case that triggered a chain of infections. Ontario Premier Doug Ford says it's a reminder to be vigilant no matter where you are.
We can't let our guard down, but we're going to be there to support all the gyms, especially the small gyms out there, because it's difficult for them. How can your heart not break for these people and not be there to support them every which way we can?
In a statement, Spinco says it's devastated by the outbreak and that contact tracing is now complete. Health officials say the company followed all safety protocols. Alberta's government is making some big cuts to that province's healthcare system. 11,000 public sector jobs will be eliminated over the next 3 years. The bulk of them, 9,700 positions, will come from areas such as laundry, housekeeping, and laboratory work, which the government intends to outsource to the private sector. At least 100 management jobs will also be cut. The job reductions could begin as early as next spring. The government estimates the changes will save $600 million annually, money it promises will be reinvested into patient care. Alberta is dealing with rising COVID-19 case numbers. The health minister vows these changes will not impact frontline healthcare workers.
I can confidently say government's direction is that there will be no job losses for nurses or frontline clinical staff. Any reductions must be managed through vacant positions and existing initiatives.
Unions have raised concerns in the past about plans to reduce public sector staff, calling the cuts ideological. South of the border, just 3 weeks until the presidential election, and COVID-19 cases keep rising. At least 37 states have had an increase in cases in the last 2 weeks. Some are setting new records. President Trump has told Americans not to let the virus dominate them. But the fact is, the pandemic is both a personal and a political issue for millions of Americans. Jackson Proskow reports.
Months into the pandemic, and these are the worst days yet in many states.
Today's numbers show more new positive cases, more hospitalizations, and more deaths than we've had during the entire pandemic.
In the last week, 7 states have set daily records for new cases. Several are on the brink of running out of hospital beds, what may be the start of the feared fall wave.
If we do not work very hard to push down the number of cases to the lowest number possible, we're going to start paying for it as it gets colder and people are indoors.
That grim reality is still being ignored by President Donald Trump, who appeared maskless while tossing out masks at a campaign rally in Florida before baselessly claiming that his own fight with COVID-19 has left him immune.
I went through it. Now they say I'm immune. I feel so powerful. I'll walk into that audience. I'll walk in there. I'll kiss everyone in that audience.
There's no proof that long-term immunity exists. There is mounting evidence that Trump's risky rallies are spreading the virus. More than a dozen people who attended this event in Minnesota have since tested positive.
His reckless personal conduct since his diagnosis has been unconscionable. The longer Donald Trump is president, the more reckless he seems to get.
President Trump is recovering from the coronavirus, and so is America.
Trump remains undeterred and is now using the words of his top infectious disease expert, made months ago out of context, in an attempt to rewrite history.
I can't imagine that anybody could be doing more.
3 weeks before the election, the pandemic has become the defining issue of the campaign, leading to incredible scenes as long lines form for early voting. But there is still no sense of better days ahead as the pandemic threatens to shape daily life for months to come. Jackson Proskow, Global News, Washington.
Chilling new information is emerging about members of an anti-government paramilitary group accused in that plot to kidnap Michigan's governor. The FBI testified at a federal detention hearing today, saying the group also discussed kidnapping Virginia's governor. They were angry about the restrictions he imposed to reduce the spread of COVID-19. A spokesperson for Governor Ralph Northam says the FBI alerted his security detail during the investigation and enhanced security measures were put in place. 13 men have been charged after the FBI thwarted a suspected plot to overthrow the Michigan state government, attack the police, and try to ignite a civil war. A high school in Ontario has launched an investigation after a racist message replaced what a student had written next to his yearbook photo. 17-year-old Joshua Telemack says the entry he wrote paid tribute to his late grandmother, and that's what was supposed to accompany his graduation photo. But when the yearbooks were distributed over the weekend, he discovered that message was replaced with a racist one that included a reference to a gorilla.
Imagine you knowing that you wrote something and like you wanted to do something good and it just got changed into something negative and horrible. That's a huge form of bullying, and like no person, no kid, no matter what age or anything you are, deserves to go through that.
The school is asking students to return those yearbooks, and it's working with the Durham Regional Police Service to determine who is responsible. The principal says there will be disciplinary action. The outlook for oil demand coming up. New projections paint an uncertain future for Alberta's oil patch. Plus, record breaker, the astonishing flight that just landed one bird in the history books. There was a stark picture painted today by the International Energy Agency. It says the era of global demand for oil will come to an end in the next decade. The agency believes the pandemic is not just a short-term shock, but a long-lasting blow to the industry, and that demand for oil will peak by 2030 as people and countries seek lower emission ways of generating power. And that will have profound consequences for oil-rich economies like Alberta. Heather Yourex-West has reaction from there tonight.
To say the last few years have been bumpy for the Alberta oil patch is to put it mildly. Job losses have been massive, and the province is facing record levels of debt.
Particularly for oil, we saw in 2020 8% drop in demand for oil as people were staying home, not flying. A huge drop. Lifestyles are changing.
Now, a new forecast from the International Energy Agency is suggesting that some of those changes are not coming back. Growth in global oil demand is set to end within 10 years, but those growth projections have been greatly impacted by COVID-19. Pre-pandemic oil demand was set to rise 12% by 2030. That's now fallen to 9%. But if COVID-19 isn't brought under control by next year, that forecast falls all the way to just 4% growth.
To a certain degree, it's sort of a confirmation of writings on the wall that others have been pointing to for some time.
It means Alberta's energy sector will need to fight harder for fewer opportunities. And that's something industry says Canada has not been successful with so far.
Today, we're losing investment to Norway, to offshore Brazil, to the Middle East. That competition isn't going to go away. And in a lower growth scenario, I think we need to be more ambitious, more aggressive.
Alberta's government says despite adjusted growth projections, the report shows oil and gas demand is not disappearing anytime soon.
That said, we also know that there's new sources of energy coming into the mix. We brought forward a natural gas strategy last week to focus on hydrogen, petrochemicals, plastics, circular economy for plastics, geothermal. We're looking at small modular reactors.
There is some hopeful news in the report. Post-pandemic oil prices are expected to surge as the industry plays catch-up with global demand. But long-term, a massive shift has begun, leaving energy-producing nations like Canada with few choices: make changes now or risk being left behind. Heather Yourex-West, Global News, Calgary.
No lines, no problem. Ahead, one tourist who got a World Heritage Site all to himself. It is not news that birds migrate, of course, but the journey this one takes is simply astonishing, and it set a new record for nonstop flight. A bar-tailed godwit was tracked as it migrated from Alaska to New Zealand. It flew up to 88 kilometers an hour, and it traveled over 12,000 kilometers in just 11 days without stopping to eat, drink, or sleep. That beats the previous record when a godwit was tracked covering more than 11,000 kilometers in 9 days. Godwits weigh on average less than a pound, and scientists still don't fully understand how they navigate over the open water of the Pacific Ocean. Well, it took a pandemic to give one adventurer the opportunity of a lifetime. Peruvian tourism officials opened Machu Picchu for the first time in 7 months, just for this one Japanese tourist. Jesse Katayama arrived to see the famous Inca ruins on March 14th, but 2 days later, Peru went into lockdown and the site was shut down. He stayed in the area, though, and local tourism authorities found out about his story, and they awarded his patience with this pristine view of the site, which would normally be crowded with thousands of visitors. Machu Picchu isn't expected to open to larger number of tourists until next month. Next, the tech-savvy teens who developed a new haven for dementia patients. With so many negative things happening around the world, it's always a plus when we can shine a light on the people making a positive difference. This story is about a group of teenage girls from Ireland who entered an international tech competition. They created an app with a personal connection, and not only did they win the top prize, it promises to improve the lives of people living with dementia. Mike Drolet reports.
When you give out an award virtually, you lose that element of excitement. But you have to think the US-based hosts of the Technovation Awards felt the earth move when 3 Nigerian-Irish girls from Drogheda, Ireland, took home the top prize.
Memory Haven.
That, by the way, is how it's done. Celebrate when you win, apologize on national broadcaster RTE later.
I'm pretty sure we disturbed the neighbors, to be honest. Probably got a couple noise complaints. But yeah, it was just unreal.
Yeah, it's pretty unreal when you beat out 1,500 apps created by students from 62 countries. And when their mentor's mother died from dementia, they honored her by creating Memory Haven, which acts as a surrogate memory for patients while keeping them connected with family.
We created an app to promote the independence of people living with dementia.
It was a runaway hit, and the overwhelming response was positive. But there's always a but. The biggest moment of their young lives was also, they say, their first exposure to racism. Their mentor, Evelyn Nomayo, tried to shield them from the hate.
I remember the night after I saw it, I was just going through it. I actually cried, especially when I saw the monkey face. And, sorry, I'm getting emotional now because it just reminded me of that time.
It was hard for all of them, but no one was going to ruin what they had achieved. So they kept smiling and singing.
I am brave, I am bruised.
Knowing how they reacted would influence girls as their mentor influenced them. And here's the best part. Leading tech innovators like Alyssa Atkins have taken notice.
I feel proud of them, not even knowing them, but, certainly their journey hasn't been easy. And without having ever met them, I feel like I know they're gritty and persistent. And it's so important to have more women like them.
And one more thing. Did I mention they're still teenagers? Mike Drolet, Global News, Toronto.
Love that. And that is Global National for this Tuesday. I'm Dawna Friesen. Tonight's Your Canada is Douglas Provincial Park in Saskatchewan, named after late Saskatchewan Premier and father of Medicare, Tommy Douglas. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.